Diphtheria is a serious disease caused by the bacteria Corynebacterium diphtheriae. Usually, the bacteria infects the throat and the pharynx. During the course of the infection, a membrane-like growth appearing on the throat can stop breathing. 3 doses of the DPT vaccine are given at 6 weeks of age, 10 weeks of age, and 14 weeks of age, with an additional 2 boosters being given at 5 to 18 months and 5 years old. DPT stands for Diphtheria, Pertussis, and Tetanus Vaccine. Transmission of the bacteria occurs when an infected person sneezes or coughs and a susceptible person breathes in the saliva or mucus droplets from the air. In reaction to the infection of the throat tissues release a discharge containing fibrous material and immune cells. The discharge covers the throat tissues and appears as a grayish membrane-like material. The throat and the trachea continue to swell. If not relieved, the swelling may obstruct the airway, leading to death by suffocation. Sometimes diphtheria bacteria infect the skin first. When this type of infection occurs, skin lesions appear. The skin type of diphtheria is more common in tropical and subtropical countries. As the disease progresses, the throat swells so much that a patient can have noticeable neck swelling. As said before, if the swelling continues, it may obstruct the airway and lead to death by suffocation. This is also known as bull's neck. Some strains of the bacteria that causes diphtheria release a toxin. The toxin, when released into the bloodstream, travels to other organs of the body and can cause severe damage. The toxin consists of 2 subunits, A and B. The B subunit binds to the plasma membrane of a cell. Once it is bound to the plasma membrane, it pulls the A subunit into the cell. The A subunit is the active segment of the toxin, producing most of the effects. Once inside the cell, the A subunit disrupts protein synthesis. Once this mechanism is disrupted, the cell cannot survive. Diphtheria does not occur oftenly in the United States because most kids have been vaccinated against it. However, some adults have not been vaccinated against it, so there is a chance that some adults could get it. In many third world countries, less than 10% of people are actually vaccinated against diphtheria. Since so many people have been vaccinated against diphtheria, the number of cases worldwide have gone from 90,000 to below 10,000 in a couple decades. Diphtheria is treated with antibiotics and an antitoxin that can neutralize the toxin that is not yet in cell membranes. It cannot neutralize the toxin if the toxin has already penetrated the cell. For this reason, antitoxins must be administered early in the infection. Diphtheria dates back to the 4th century BC. Today, it has a 5 to 10% fatality rate. There has been no reported case of diphtheria since 2003.